Hello everyone, in this video we are discussing the muscles which are going to be attached to femur bone. Okay, so before starting with the muscles we should be knowing having a basic information about femur. So we'll be starting with that. So here you can see, if I zoom it out, this is the interior surface of femur. So on the interior surface you can see this structure. This is the head of femur, right? There is a presence of a fovea, dent like thing on the head. Okay, so this is fovea. Then we have neck of femur. Okay, so this is head, neck. Now you can see here this structure. This is the intertrochanteric line. Okay, so on the interior side we have something known as intertrochanteric line. There are muscles which are getting attached there. Then if we see here, you can see this prominent like structure. This is known as the greater trochanter, right? So all these structures we are discussing is on the interior side. Okay, and you can see here we have shaft of the femur. This is all the shaft of femur. If we go on the posterior side, there is something which I have to show. I told you this one is a greater trochanter. I have come to the posterior side. Okay, so this greater trochanter, and here this one, this is the lesser trochanter, right? So we have these two prominent structures. There are muscles, many muscles are getting attached there. Then we have something, the intertrochanteric crest. Then one more thing, this is the gluteal tuberosity, important muscles are attached here. And we are on the posterior side only. Now one thing more, on the posterior side we have this linea aspera. This is the lateral side and this will be the medial side. Here also this is linea aspera. Many muscles attachment are present on the linea aspera. Now if we are coming towards the downside, we will be discussing first the anterior side. Okay, so on the interior side you can see here. Okay, so this is interior. Okay, so where our head is, that will be obviously the medial side. So this is medial side, so this will be our medial epicondyle. So opposite side there will be lateral epicondyle. Clear with that? Popliteal surface. Okay, for the popliteus muscle to get attached here. Then we have the lateral supracondylar line, the medial supracondylar line, that is there. Intercondylar line will also be present. Then we have something intercondylar fossa. You will be knowing this is medial condyle and we have seen that. Okay, one more specific thing, that is the adductor tubercle. See here on the lateral, oh sorry, on the medial side we have something as the adductor tubercle. Okay, one muscle is getting attached here also. So this is what all about the femur is. Okay, now let's discuss with the muscles which are attached here. So we will be starting with the muscles which are getting attached on the greater trochanter. Okay, so greater trochanter, these muscles are attached: piriformis, gluteus minimus, obturator internus, and two gemellae, obturator externus, and gluteus medius. Okay, all these 7 muscles are getting attached on the greater trochanter. We will be seeing that. So here you can see this is the muscles which are getting attached. Here you can see this is our greater trochanter. Okay, so one by one we will be seeing which muscles are attached. So starting with the big muscles which we can see there, these ones. This is the gluteus medius, you would be knowing. Okay, this one is gluteus medius and it is getting attached on the lateral surface. Okay, so it is attached on the lateral surface. Okay, here you can see here clearly. Okay, so this is the lateral side, so it is getting on the lateral surface. This is gluteus medius, right? Individually I have already made videos, but here I am combining all the muscles and showing it in the bone. Okay, then you can see just below this, you would be knowing this is our gluteus minimus muscle, and this is also getting attached on the greater trochanter only and is attached on the lateral part of the anterior surface. Okay, this is somewhere, if you see here, like this it will be, so this will be coming the lateral part of the anterior surface. So this is gluteus minimus and this was medius. Okay, we are done with both these. Now if we go further, so we have these muscles here. You can see, you would be knowing this is our piriformis muscle. Okay, piriformis, and this muscle you can see that this is attached here. This will be the apex of the trochanteric. Okay, greater trochanter, right? So this was the piriformis which is getting attached. Now we have this one. You would be knowing this is obturator internus. Okay, this is obturator internus, and here this will be the obturator externus. Okay, you would be knowing the reference, we are not discussing that. This is obturator internus and this is the obturator externus, and both of them are getting attached on what? They are attached on the greater trochanter, just that they are attaching on the medial surface. Which one? The obturator internus is attached on the medial surface, right? And the obturator externus, here you can see this one is getting attached at the this one here. Here it is the trochanteric fossa. So it is getting attached at the trochanteric fossa, okay? But it is the greater trochanter only. So both of these are we are done with. Now we are left is the gemelli, okay? So there is the gemellus superior and the gemellus inferior. These two muscles, they are also getting attached along with the obturator internus only, okay? So all three muscles are attached like that. So these were the 7 muscles which are getting attached on the um, greater trochanter, okay? So I hope you are clear with this: gluteus medius, maximus, and obturators, and the piriformis. That these were all inserted, okay? All these muscles were inserted, right? So if I am writing something with blue, that is mean that the insertion of these muscles is taking place on the greater trochanter. Now we are coming down, we are discussing muscle attached to lesser trochanter. So only two muscles are getting attached, that is psoas major and iliacus. We will be seeing it them now. So here you can see this is our the psoas major, okay? This is psoas major and this one is iliacus. I have made individual videos also, you can watch them also, and you can see very clearly that these muscles are coming and getting attached on the lesser trochanter, right there. Here these are inserted on the lesser trochanter, okay? So very clearly you can see here this one is the lesser trochanter muscle, both of them are getting attached, okay? So this was very simpler, okay? Now we will be seeing the muscles which are getting on the intertrochanteric line. So for intertrochanteric line, they says that the highest fibers of two muscles, they are vastus lateralis, okay? Vastus lateralis here and vastus medialis are coming from the intertrochanteric line, okay? So there is the origin, okay? So origin of both these muscles coming from the intertrochanteric line. All the way we know that it is coming from linea aspera mostly. So some highest fibers of these two muscles comes from the intertrochanteric line only, okay? Now next we have the quadratus femoris. So we say that there is an insertion of quadratus femoris, here you can see, and this is taking place here, which has the quadrate tubercle. So with the tubercle only, the muscle named is quadrate tubercle, the insertion of the quadratus femoris taking place, okay? You can see here. Now we are going to see the muscles attached to the shaft. So there are many muscles, we have to discuss them. So the first one is that medial head of gastrocnemius are coming originating from the shaft. Vastus intermedius, articularis geni, vastus lateralis, vastus medialis. So important muscles we will be seeing how they are getting originated, and there are insertions also of the gluteus maximus, adductor longus, adductor brevis, adductor magnus, pectineus, short head of biceps femoris, plantaris and upper part of lateral head of gastrocnemius or originating. So this is origin. So these many muscles are coming from shaft. I know this is confusing, but we will be trying to simplify this, okay? So here you can see this one, the vastus intermedius, okay? Vastus intermedius muscle you can see here. So what is that? They say that the vastus intermedius is coming from the upper 3/4 of anterior and lateral surface of shaft, okay? So no clear demarcations are there, but you can see very clearly here, right? So this is vastus intermedius, this is coming from, or we can see individually also. Here you can see this is coming from the anterior as well as lateral surface. So this is vastus intermedius, okay? So it is coming from the shaft. Very clearly you can see this is the origin of vastus intermedius. Okay, then we have is the vastus lateralis. Okay, so this is also, they say that the origin of vastus lateralis comes from the intertrochanteric line, we have seen already. Okay, so intertrochanteric line it is getting coming from, then there is from the greater trochanter also, then from the lateral margin of gluteal tuberosity also the origin is taking place. Okay, so you can see individually also how these are coming from, and from the upper half of lateral lip of linea aspera also the origin is taking place. From along with it is just coming from the gluteal tuberosity also, from the greater trochanter also. So this is all is the vastus lateralis. Similar to this, we are seeing this is vastus medialis. Similarly to the lateralis, it is also originating from the trochanteric line. We are seeing intertrochanteric line, right? I'm not writing that spiral line. Then also from the medial lip of linea aspera, it is getting originated, and from the medial supracondyle line also. So these many origin of the vastus medialis is seen here. Okay. Now we are coming to the insertion. So you can see here the gluteus maximus, and I told you about gluteal tuberosity in the very beginning. So here we can see that gluteus maximus is getting inserted on the gluteal tuberosity, which is present on the posterior side. I showed you in the starting of the video. You can see it. This is the gluteal tuberosity, and the gluteus maximus is getting attached here, right here, like this. This is the anterior side, and we are seeing the gluteal tuberosity, right? So this was the insertion of the gluteus maximus muscle. Now we are coming on the insertion of the adductor longus. You can see this is the adductor longus, and we are going on the posterior side, and they say that the adductor longus is getting inserted. Okay, it is getting inserted. First of all, it is an insertion of the adductor longus muscle, and it is on the medial lip of linea aspera, right? So the linea aspera, medial lip of linea aspera, the insertion of adductor longus is taking place. Now you can see this is adductor magnus, and the insertion of adductor magnus here you can see it is getting attached on the linea aspera, right? So linea aspera it is getting attached, as well as it is getting attached on the medial supracondylar line. Okay, medial supracondylar line. Along with this there is adductor tubercle also, it is getting attached on. Okay, and they say it is getting attached on the medial margin of gluteal tuberosity also. So this is how you can see this is the attachment of the adductor magnus. Very clearly see. Okay, this is how it is. Also the adductor brevis is also getting inserted on the linea aspera. Okay, so it is said that it is inserted on the line extending from the lesser trochanter to the upper part of the linea aspera. So this is how the insertion of the adductor brevis takes place. So along with this you can see here there is some origins also taking from place from the below. Okay, so here you can see this is the gastrocnemius muscle. So from the lateral supracondylar line, the origin of the gastrocnemius also takes place. Along with plantaris also you can see. So plantaris is also getting originated from there also, and the short head of biceps femoris is also getting originated from the here only. Okay, so from the lower part you can see very clearly this is the posterior side, and the origin is taking from like this. Okay, lastly we will be seeing the origin, one more muscle. The origin of the popliteus muscle is taking place, and it is coming from the lateral epicondyle. Okay, I'll show you now. So from the lateral epicondyle the popliteus muscle is coming from here. You can see this place, this is the popliteus muscle, and here this is the lateral epicondyle here, and from here the origin of the popliteus muscle is taking place. Okay, I hope you understood this point and this video, and it was long, I know that, but I hope you got all the origin and insertion of the muscle.